Anybody that's got foot drop will know that you're only one trip away from falling over. My name's Mark Shaw, I'm 53 years old. Last summer I was diagnosed with a giant calcified disc between my vertebra T10 and T11, which was slowly compressing my spinal cord and gradually paralysing me. So I was faced with the only option really, to have an operation to decompress my spinal cord and remove this giant disc. Unfortunately, the operation damaged my spinal cord, so it bruised my spinal cord, which paralysed me and left me without the use of my legs. I got the feeling back in my left leg very quickly, but my right leg was paralysed. 7 or 8 months post-operation, and things are going in the right direction, but the nerve that controls raising my foot is actually weak. When I walk, my foot and my toes can tend to catch on the ground as I step through. I first heard about FES through one or two of the forums, the social media forums for spinal injuries, which have been really a source of real help and comfort. But I really found out about it in detail from the spinal neurosurgery rehab unit at Wakefield Pinderfields Hospital. It was Mr. Raza there when I'd gone for a routine rehab appointment, had said that FES could help my foot drop. I went to the clinic in York, had the first consultation, and the signs were good from that initial consultation, and the clinician then wrote a letter to my GP referring me for FES treatment through the NHS. And then I had a follow-up session once those letters had exchanged hands, probably 6 weeks later, to actually get fitted up with the FES equipment. FES has undoubtedly allowed me to carry on a normal way of life that includes work, so it's allowed me to be more naturally mobile. I'm not as mobile as I used to be, but in terms of getting outside, if I need to post letters, for instance, go into town, it's a lot easier for me to be mobile with FES than anything else. If I didn't have it, then I'd probably be relying on my sticks a lot more. I generally tend to wear it first thing in the morning if I'm taking the dog for a walk, and I'll do a 2 or 3 mile walk and I'll have the FES on. Using FES makes me feel more confident, particularly with walking. Being able to lift my foot up normally is a great advantage, because when you've got a spinal cord injury and you've got lack of mobility in your legs and you're learning how to walk again, you have to think about what your legs are doing. You have to tell your leg to lift up, and the FES actually helps fill in the gaps, if you know what I mean, because as you lift your foot up, it will stimulate the nerve which brings the foot up naturally. If you don't have FES and you're just using a walking stick, then you're mentally having to think about lifting your foot up, and that's really tiring. If you go for a long walk and you're having to think about lifting your foot up and not tripping up, it's actually mentally quite tiring. So FES gives you a lot more confidence, and it means that you tire less as well. I would advise others, particularly with foot drop, to give FES a try. It's certainly given me more confidence, and it's been another tool in the toolbox along with everything else that you've got, whether that's physiotherapy, ongoing rehab and the exercises. It's certainly worth trying, and it's certainly given me benefits so far, and I've only been using it for 4 months.